COVID-19 transmission is mostly through droplets from sneezing and saliva. The most effective way to protect yourself from the virus is to practice good personal hygiene. Wash hands with soap under running water or use an alcohol-based sanitizer if water is not available. Maintain at least 2 meters distance between yourself and anyone who is coughing or sneezing. Cover your mouth and nose with your elbow or tissue when you cough or sneeze. Dispose of the used tissue immediately. If you have traveled recently to a country with COVID-19 outbreak in the last 14 days and you have a fever, cough, or breathing difficulty, call NCDC toll-free numbers before going.
Hello and welcome. This is the news on NTA International. I am Lami Ali. First, the headlines. Federal government expends 4.5 billion naira on 31 federal teaching and medical centers for payments and allowances. Nigeria rejects new level misrepresentation by UK all-party parliamentary group on international religious freedom report. United Nations marks World Sickle Cell and elimination of violence against women in conflict situation, urges collective action. Many thanks for joining us. The federal government this Friday says it has expended close to 4.5 billion naira on 31 federal teaching and medical centers in the country for payments of hazard and inducement allowances for the months of April and May this year. Minister of Labour and Employment, Chris Ngige, disclosed this after briefing President Muhammadu Buhari on the actions taken so far to halt the ongoing strike embarked on by members of the National Association of Resident Doctors early this week. State House correspondent Judy Onifadi reports that the minister is optimistic that the NARD will soon call off the industrial action.
Minister of Labour and Employment, Dr. Chris Ngige, in company of the Minister of Health, Dr. Osage Hanire, and Minister of State for Labour and Employment, Festus Keyamo San, had briefed President Muhammadu Buhari on the strike by the National Association of Resident Doctors and actions taken leading to progress towards ending the strike.
In the payment, because we are paying them for the arrears of April and May. And the payment for June will also be done immediately. These ones are sorted out. So we have expended 4.5 billion as we speak this morning for these payments.
Ngige says the federal government will facilitate a meeting between the resident doctors and the Governors Forum to address the issues concerning state.
The issue of health is on the concurrent list. So the federal government will do their own, and the state governments are also expected to do their own. Some of their grievances are on what they feel that the state governments have not done.
Minister of Health Osage Hanire explains that the president was visibly unhappy considering the implications of the strike action at this time when all hands must be on deck to protect Nigerians from the coronavirus pandemic.
And what we have also urged the resident doctors to do is to have some trust in the system. This is a government, a regime that has always lived up to its expectations and always met its promise. And we hope that they will understand that the fight against COVID-19 in particular and the fight against all diseases in general is a collective responsibility of everybody. It is not just government as a person. We as medical professionals have an obligation on our own.
The association on Sunday had instructed its members to down tools over a shortage of personal protective equipment and poor remuneration for members as they battle the raging coronavirus pandemic. In the State House, Jide Onifade, NTA News.
Meanwhile, President Muhammadu Buhari has directed federal ministries to interface and come up with feasible initiatives towards achieving the administration's vision of lifting 100 million Nigerians out of poverty within the next 10 years. Minister of Special Duties and Intergovernmental Affairs, Senator George Akume, whose ministry is coordinating the Interministerial Forum, says it will have a positive effect on job and wealth creation nationwide. Mitari Ikpen has more.
At a time when the effect of the coronavirus pandemic is biting hard on the economy, there is a consensus to link the programs and policies of federal government ministries, departments and agencies to maximize the opportunities for job creation, poverty reduction and wealth generation along economic corridors. The inaugural Interministerial Forum, chaired by the Minister of Special Duties and Intergovernmental Affairs, had in attendance the Ministers of Environment, Water Resources, Industry, Trade and Investment, Agriculture and Rural Development, as well as the Governor of Ekiti State, who is the chairman of the Nigerian Governors Forum.
A lot is happening in ministries and parastatals. Nigerians are not aware of this, and that is their binding need for coordination of these activities with respect to job creation and welfare of Nigerians. We will continue to meet from time to time in giving effect the presidential directive on lifting 100 million Nigerians out of poverty.
Especially in the wake of the collapse of oil prices, what do we do with agriculture? What do we do with education? What do we do with infrastructure? What do we do with the digital economy, which is increasing in its relevance?
Most of the ministry have been taking advantage of low-hanging fruit already. Like you heard, environment, they have been planting millions of trees already around the country. That will involve recruiting people who will do that.
Some of the decisions reached at the meeting include the setting up of a technical committee of experts to develop an implementation strategy for the forum and the need for intergovernmental cooperation. In Abuja, Mitari Ikpen, NTA News.
And in another development, Nigeria has rejected the new levels of misrepresentation in the UK All-Party Parliamentary Group on International Religious Freedom Report on Nigeria, launched a few days ago. The report, which also acknowledges the importance of accurate, unbiased, depoliticized and truthful information when it comes to understanding the realities in Nigeria, however, notes that when uncritical attention is given to critics with dubious intentions, it only becomes harder for both the government and people of Nigeria to engage in constructive dialogue in resolving differences and uphold what is enshrined in the Constitution. And confirming Nigeria as a polio-free nation by August 2020 is gradually becoming a reality as the African Regional Commission for Certification of Polio Eradication, ARCC, accepts the country's wild polio virus-free documentation. Chairman of the ARCC, Professor Rose Leakey, gave the indication at a meeting with the Nigerian team led by the Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shoaib and partners. Professor Rose Leakey stated that ARCC, an organ of the World Health Organization, has for the past years assessed the performance of the National Primary Healthcare Development Agency in polio eradication, and the results have been quite impressive. Still on health matters, the gift of good health is taken for granted by many people. However, some individuals are not fortunate as they are born with disorders they have to live with due to their genetic predisposition. Sickle cell disease is one of such. Uche Gochukwu tells us more as the world marks Sickle Cell Awareness Day.
The prevalence of sickle cell traits ranges between 10 and 45% in parts of sub-Saharan Africa, with Nigeria recording about 20 to 30%. 39-year-old Mark and 19-year-old Hope are among the 2 to 3% of Nigeria's population with tales of excruciating bone pains, bacterial infections and anemia due to sickle cell disorder.
Get to have serious pains, excruciating pains really.
A lot of challenges, like now, my mates, they are ready for their exams, but I'm here. Before, I was still like 3 years, I haven't been to the hospital, but now, because of exposure to cold and not taking drugs regularly, and water again, the crisis started coming regularly.
Intending couples are advised to know their genotypes before marriages.
Imagine you as a mother taking care of a child about 18, 19 years, cleaning her up, wearing her things. You know, it's not easy. That this condition come, it's not her fault, it's not neither our own fault, because that at that time we're not exposed so much that we know to go and do tests, or genotype tests, all those things before we get married.
For them to prevent this crisis, we encourage them to avoid strenuous activity because that also predisposes them to crisis. For people that are in school, we don't allow them to do all the rigorous activities that happens in school. So that's another way they do to prevent it. They sleep under malaria-treated nets so that they won't have malaria infection. They try to keep themselves warm, especially during cold season.
Although Mark is not in serious condition as Hope, he appeals for legislation to assist sickle cell carriers in society.
I am a graduate, I am a civil servant, really, but a lot are not fortunate like some of us to be employed, and it's a tough one, trying to manage to get drugs, trying to get finance to come to the hospital when in pains, and a lot of challenges, particularly when the complications as a result of the blood challenge starts coming. It's a tough one. We need help. Government needs to subsidize a lot of things for sufferers so that they can live up to their potentials.
World Sickle Cell Day aims at raising awareness about the disorder, which symptoms manifest from age 5 to 6 months. Uche Ugochukwu, NTA News.
And now joined in the studio by Dr. Ikaise David, a consultant hematologist and head of hematology departments, National Hospital Abuja, to discuss issues arising from sickle cell and various interventions for management of crisis in Nigeria. Dr. Ikaise, you're welcome to our studios.
Thank you very much. Thank you for having me.
Now, has there been a concerted effort medically to reduce crisis for sufferers of sickle cell?
Yes, there has been. There's a lot of research going on finding new drugs in addition to the ones we presently have, and new modalities of therapies to try and reduce their frequency of pain crisis.
Now, in terms of quality and affordable health care, what is our situation in Nigeria?
Well, at the moment, for a lot of our patients, apart from a few of them that happen to be civil servants, that are under the National Health Insurance Scheme, a lot of them pay out of pocket, and that is a big drain on the family resources because the family has to cough up all the money that is needed for their treatment whenever they are ill and they come into the hospital. And that has led to reduction in their quality of life because a lot of them, when they don't have money, they just don't show up even when they are unwell.
Now, as an expert in this area, what's your message for people on this day as we mark the International Day of Sickle Cell?
So today is a day to say, give hope to the sickle cell patients who are called sickle cell warriors, to praise them because we have a lot of them in different areas, in different fields that are making a difference. So today is a day set aside to celebrate them. Today is also a day set aside to employ people to know their genotypes, especially before they get married. It's important that people know their genotypes and go for pre-genetic marriage counseling so as to make accurate, informed decisions.
Now, how do we prevent such disorders?
Okay, well, the sickle cell disorders usually arise when two couples that have the sickle cell traits, known as the AS genotype, get married. In every pregnancy, there's a 25% chance. So in every pregnancy that a woman has, if she's AS and she's married to an AS, there's a 25% chance of coming up with a sickle cell child. So we would usually advocate, please know your genotype and ensure that if you're an AS or a carrier of an abnormal hemoglobin, AS, AC, ensure that your partner has an AA genotype. So that way we ensure that it is carriers that are given birth to and not people with genetic diseases.
We thank you very much for sharing your thoughts with us.
Thank you very much for having me.
I've been speaking with hematologist and the head of hematology department, National Hospital here in Abuja. Now, COVID-19 cases in Nigeria have surged past 18,000 as the United Kingdom lowers its coronavirus alert level after steady decrease in infections. Let's now join Joyce Ometu for latest developments on the pandemic.
The World Health Organization (WHO) is warning that the global coronavirus pandemic is accelerating as 150,000 new cases were recorded on Thursday, the highest in a single day. Johns Hopkins University's latest count says there have been 8,639,987 COVID-19 cases globally. Out of the number, over 4.5 million patients have recovered, while 457,789 persons have died. The United Kingdom's chief medical officers have agreed to lower the country's coronavirus alert level from 4 to 3. This implies that the virus is still in general circulation, but transmission rate is reduced. However, the Joint Biosecurity Center warns that the move does not suggest the pandemic is over. In Honduras, President Juan Orlando became the latest world leader to be hospitalized after testing positive for COVID-19. His doctors said the president, though in a stable condition, would remain in hospital for treatment. And from China, a public health official said the current outbreak in Beijing is under control. However, few new cases were recorded. In Africa, statistics compiled by Worldometer as at 6 p.m. show that the continent has registered 280,748 infections, 7,492 deaths, and 130,938 recoveries. Back home in Nigeria, 745 new infections were recorded on Thursday, indicating the highest daily figure of confirmed cases as announced by the Nigeria Center for Disease Control. With the latest updates, the total number of infected persons in Nigeria has risen to 18,480, while 6,307 persons have recovered and 475 fatalities have been recorded. And that's a global update on COVID-19. Many thanks for watching. I am Joyce Ometu.
You're watching the news on NTA International. We will take a break now. More stories when we return.
Welcome, dear. Have you washed your hands?
Inside my house again. This thing not the key black man.
I don't know if it's misinformation or poor hygiene that will kill you first. Coronavirus is real, and good hygiene practice will save your life. Anyway, no hand washing, no eating.
I will not take care of it. How's one of the parents? Coronavirus is real and it's on the rise. But you can help yourself and help others to be safe. Remember, we can stop the spread. It's in your hands.
This message is from the Akin Fade Foundation in partnership with the National Orientation Agency with support from MacArthur Foundation.
You're welcome back. The United Nations General Assembly in 2015 proclaimed 19th June as the International Day for the Elimination of Sexual Violence in Conflict in order to raise awareness of the need to put an end to conflict-related sexual violences. In this report, Basi Itaikpang takes a look at forms of sexual violence, the economic impact, and the effect on victims.
Conflict-related sexual violence refers to rape and other forms of sexual violence perpetrated against women and men, directly or indirectly, during conflict situations. Records show that 1 out of every 3 women and 1 out of every 30 men have experienced sexual violence in a lifetime.
In what situation? Violating women. His crime, his prosecution should be as if he has committed genocide against a group of people, especially the crime of sexual violence in armed conflict. No.
The normal human being will not rape. So the society is involved. The security is involved that is supposed to protect the people.
To highlight and put an end to these challenges around the world, inform the destination for this day.
We say elimination of sexual violence in conflict situations that relates to rape, forced prostitution, forced sterilization, forced marriages, everything, that has to do with sexual offense or sexual violence in a dysfunctional society.
The government have to rise up, NGOs have to rise up, and then we need to all come together and fight this.
Though Nigeria is not in a war situation, advocates frown on the rampant cases of rape in the country, with emphasis on drastic action against perpetrators.
So we need to come out with boldness as women and cry out and look at our children and tell the men, redeem their glory by leaving our daughters alone.
This advocates say is a serious public health and human rights problem with long-term consequences on women.
Stop the violence.
Combating impunity for sexual violence is a central aspect of deterring and preventing such crimes. It is also a central element of providing redress for victims. Bati Taipa, NTA News.
Also in our studio to speak on the International Day to Eliminate Sexual Violence Against Women in Conflict Situations is Lansana Wone, United Nations Women Deputy Representative. Wone, it's good to have you join us in our studios. It's good to have you join us in our studio, Lansana.
Thank you very much.
Now, what acts constitute sexual violence in conflict situation?
Sexual violence take quite diverse forms. The worst forms are rape. Rape is among the worst forms of human rights violation. But it also forms situations where women, for instance, are forced to go into sexual relationship where they are exploited because of their marginalized situations or deprived situations that they find themselves. It also includes situations where younger girls are forced to marriage, even beyond the recognized marriage age, or where women are also forced to marry either because of economic reasons or social reasons that they find themselves in conflict situations. So those are the different forms of sexual violence. It also takes a situation where it also takes characteristics such as women exchange for sex for security, for safety, etc., etc. I mean, those are all forms of sexual violence in conflict situations.
Now, looking at the various incidences, women are the most vulnerable in conflict situation. Would you say the campaigns so far have raised adequate awareness and have succeeded in, eliminating such incidences or bring them down to a minimum?
No, I wouldn't say so. I think we are far from what we can say success. However, I recognize the fact that the campaign has been growing over the years, and the fact that we have a day recognized by the United Nations set aside to commemorate a day which is a date to reflect on the situation of women is an indication of the massive campaigns that had gone into creating this awareness that made the world body and all the different governments in the world to recognize this day. I know, however, that there is a lot of effort on the part of civil society organizations, in particular women rights organizations, to create this awareness. And so this awareness, the situation is also recognized by governments in several contexts. Laws have been promulgated to be able to deal with people who are perpetrators of sexual violence in conflict situations. Having said that, the situation still persists, and we are far away from having one we can call a success, or one we can call that we have minimized it to the level of staying closer to normalcy.
All right. Now, as stakeholders, what are we supposed to do in order to, have this message pass across?
I think we all have responsibilities as individuals, as organizations, both in the public and private sector, as government, as civil society organizations, but also as international bodies, intergovernmental bodies such as the United Nations, etc., to continue to scale up the campaign. But not only merely making campaigns, but taking concrete actions to stop violence against women and girls in conflict situations. But of course, I can say violence against women and girls even in normal situations, because that in itself is a big issue. I know that in Nigeria, for instance, it's a very big issue. So yes, it's one thing to do the campaign. Yes, it's another thing to promulgate laws, but the important thing is to be able to implement those laws, and for individuals and institutions to take concrete action to make sure that those who perpetrate violence against women and girls in conflict situations, but also outside conflict situations, are brought to books.
We thank you for your comments.
Thank you very much.
That was Lansana Wunde, United Nations Deputy Representative. Now, All Progressives Congress says its attention has been drawn to an ex-parte order allegedly granted in favor of Victor Giadom per motion number FCT-HCM 6447-2020. The party, in a statement by its National Publicity Secretary, Lanre Isaunilu, reminded the general public that none of the 4 defendants named on the state process were served with the originating processes in the suit, and as a result, the party became aware of the existence of such an order on June 17, 2020, through its circulation on social media. The party assured its team members that the APC has no leadership vacuum, adding that by the constitution of the party, Senator Ajimobi has assumed the role of acting national chairman following the decision of the Court of Appeal upholding the interlocutory injunction suspending the national chairman from office. And Governor Godwin Obaseki has officially picked up the PDP party card. By this development, the governor is now a member of the PDP. The state chairman of the party, Tony Azegbemwin, Chairman Ward 4, and other party officials received the governor. Now, time for sports news. Ministry of Youth and Sports Development partners FCT administration on the transformation of the Moshood Abiola National Stadium.
In just a week of its official unveiling as the Moshood Abiola National Stadium, efforts are being intensified for an appropriate public-private partnership arrangements to restore the lost pride of the national monument. This formed the thrust of discussion when Minister of Youth and Sports Development, Sunday Dare, met FCT Minister Mohammed Musa Bello in Abuja.
We look at the competencies that the FCT has. I want to see a way in which we can partner and collaborate and leverage on them.
But it's very important, Honorable Minister, for the ministry to work out a long-term sustainable plan to make sure that once it is rehabilitated, then it can continue to do that.
In a related development, Sports Minister Sunday Dare has received the report by Edo 2020 Sports Festival Committee on the possibilities of hosting the event this year after coronavirus pandemic caused an initial postponement. The committee, chaired by Tonobok Okowa, has made several recommendations on dates, processes and procedures as the ministry assures on observing all guidelines before a decision on the festival is reached. Away from Nigeria, the German Bundesliga continues, just as the English Premier League, where Arsenal seek to bounce back from a 3-0 defeat to Manchester City midweek when they play against Brighton and Hove Albion in a match that will be beamed live on the NTA on Saturday at 2:30 p.m. With sports updates, Ayodeji, Makinde, NTA News.
That's a wrap on the news. We thank you for watching.